Okay, welcome again, everybody. I am Joanna Cohn. I'm the director at the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health in Baltimore in the United States. And I'm so pleased to welcome you to this month's Innovations in Tobacco Control series. I'm delighted to introduce our speaker today, Mr. Praveen Sinha. And he has spent about 13 years working on tobacco control with the Ministry of Health and the World Health Organization. Currently, he is the National Professional Officer for Tobacco Control in the country office for India of the World Health Organization. Earlier on, he had worked at the grassroots level in an organization in the tribal pockets of Madhya Pradesh in India. So he has, experience from, grassroots and civil society through to government and extra government organizations. And given his extensive experience in tobacco control and seeing how things work at many levels and from the inside and outside, we're just thrilled to have him here today to talk about some of his insights around tobacco control in India. I'll just say that Mr. Sinha has published on a number of topics, he's co-author on papers related to tobacco attributable deaths in India. He has written about tobacco imagery in on-demand and streaming content in India. He has written about the affordability of tobacco products in India and illicit cigarette consumption. And he's also written about the important beedi industry in India. And, India is such an important country in the world, but so important when it comes to tobacco control because of the huge burden of preventable death and disease. And at the same time, there have been so many innovations in policy and practice that have happened in India in tobacco control. And just to name a couple, India has one of the largest pictorial health warning labels on tobacco packs. India has banned Gutka, a key smokeless tobacco product. India has banned e-cigarettes, one of the few countries that has been able to do that. And also there's been some great innovations around smoking in the movies and tobacco control messages there. So I'm so pleased that Mr. Sinha is going to tell us about some of his sort of insights around tobacco control from India. So I'm going to hand it over to you. Thanks so much for joining us.
Thank you, Joanna. Thank you for the brief introduction. And it has been a truly great journey for tobacco control in India. From 2007, I've been working on tobacco control from all the sides, from the government, from the civil society, and now from the WHO. So it's been more than a decade, but still it's a learning curve for me. And this learning curve has driven me to this innovative lecture series. And I'm thankful that you have given me the opportunity, and I'll be sharing some of the good practices that we have done. And these practices have been possible through a whole of a society and a whole of a government approach, wherein all the partners, the government, the civil society, the media, the judiciary, they have played their role in getting it through the various ups and downs of the policy channels and the judiciary channels. So now I'll share the screen and start my presentation. Yeah. So I hope the screen is visible to all.
Looks great.
Yeah. So this is the Innovations in Tobacco Control lecture series from the Institute for Global Tobacco Control, John Hopkins Bloomberg School of Public Health. And today I'll be speaking on tobacco control learnings from India.
There might be an arrow at the bottom, a little hard to see, like just under your slide, an arrow pointing to the right to change a slide.
Can't see it.
Let's see. Maybe on the left-hand side, on just around, yeah, bottom left.
Excuse me, can't hear a word.
Yeah, we're just, yeah, we're just getting the slides to change. Will just be a second. Carla, I'll ask you to help.
Sometimes you can advance by just hitting the arrow on your keyboard.
Is it visible?
Yes.
So this is the burden of tobacco use in India, and few facts about the burden of tobacco use in India, which is taken into consideration whenever there's a policy. Is it visible now?
Visible, but make it full screen. Yeah, fine.
Yeah.
Great.
So coming back to the first slide, sorry for the technical hitch. So this is about the burden of tobacco use, few facts and figures from India. As you know, India is the second largest producer and consumer of tobacco products in India. And to be specific, from the Global Adult Tobacco Survey, we have 28.6% of the adults use tobacco in some form, which means that 1 in 3 individual, they consume tobacco, and the total number of tobacco users are approximately 267, out of which 200 million are users of smokeless tobacco and 100 million users are smoking tobacco. 267 million is approximately 10 times the population of Australia. And from the perspective of the death and disease it causes, we have figures from the government which says that over 1 million deaths each year is attributed to tobacco use. And this is very worrisome, and most of these deaths, they are entirely preventable through evidence-based policy that can be adopted by the government. And we have a latest research from the Indian Council of Medical Research, which is the research wing of the Ministry of Health, which says that 27% of all cancers in India can be directly attributed to tobacco use. And in India, every year there are around 1.4 million new cases of cancer each year. So whenever you take a strong policy step, the tobacco industry comes back hitting at the government saying that, look, this is the amount of revenue that we give to the government of India or any governments across the world. So in order to address this, in 2011, the government of India had commissioned a study on economic burden of tobacco-related disease. This year, WHO undertook the same study with new data and improved methodologies. And we found out that the economic burden of tobacco-related disease in India for the age group 35 years and above is approximately 27.5 billion US dollars. And this was for the year 2017-2018. And this economic cost was 1.04% of the national gross domestic product in 2017, and the revenue generated in 2016 and 17 was only 12.2% of this estimated cost. So now we know what is it that the tobacco industry is uh, putting in the economy, and what is it that the tobacco use is taking out of from the economy. It is just like uh, putting money in a hollow bucket. Even the total budgetary expenditure of the health ministry is half of this. Last year it was around uh, just half of what the total expenditure was on tobacco attributable disease. And from the supply side, since India is the second largest producer of tobacco, we have, as per the Ministry of Agriculture, there are 6 million farmers, 20 million farm laborers, and tobacco crop is grown in 0.27% of the net cultivated area. So it is only 0.27% of the net cultivated area where tobacco is grown. Also, we have something called the BD, which is the indigenous form of cigarette and which is rolled on leaves from the tendu plant, and BD rolling provides estimated employment to around 4.8 million. Most of these 4.8 million are women who undertake this BD rolling as a part of their daily household activity, and it's mostly taken on a part-time basis. And above this, we have 2.2 million tribal workers who are involved in the tendu leaf collection. So tendu leaf collection is an input to making BDs. So before making any policy, these are the basic facts and figures the policymakers have to consider from supply as well as demand side. So this is about the diverse form of tobacco use in India. So basically, if you classify, we have three broad categories of tobacco use forms. First is the smoking forms, and within smoking forms, we have a lot of products: bidi, cigarette, cigar, chewut, rolled cigarette. We have local products, chutta, dhumti, and some of these products, they are smoked in reverse fashion, which means that the burning end is inside the mouth. So this is one of the phenomenon of smoking, consumption of smoking tobacco products, distinct from other countries. The other phenomena in form of consumption is smokeless tobacco. And as per the Global Adult Tobacco Survey, we have 200 million users of smokeless tobacco in India. This is in the adult age group of 15 years and above. And this is approximately 70% of the global users of smokeless tobacco. We can say they are in India. And there are a lot of products on smokeless tobacco. In fact, every state has a different product, and many of these products are not made in factory, not made in the organized sector. They are assembled at point of sale. Some of these products which I have tried to list is betel quid with tobacco, there's surti, khaini, or the tobacco lime, there's gutka, pan masala with zarda, there's mawa, gul, gudaku, misri, kivam, kharra, dhura. So, and this list goes on and on. Every state at some national level has a different kind of product. And there are other products like tuibur, which is tobacco in form of water, and it is gargled. And also we have tobacco used in toothpaste in some parts of the country. So broadly, these are the categories of tobacco use in India. So in this presentation, I'll be focusing on uh, three important learnings which have come out from India. First is the tobacco-free film and television rules. India is a pioneer in this tobacco-free film and television rules. Second is the ban on smokeless tobacco. This is very important for India, where 200 million smoker, they are users of smokeless tobacco, 200 million, 70% of the global users of smokeless tobacco is there in India, and reducing access to youth. This is one of the most important strategies, because tobacco industry catch them young. That is the catchword. So we also need to catch the youth young, so that we shut the gate. We do not allow young users to become addicted. We do not want a young generation to be addicted to nicotine or tobacco use. So this is about the Tobacco Control Act of India. Very simple act. There are four key provisions. One is related to prohibition of smoking in public places. Second one is on ban of advertisement, sponsorship, and promotion of tobacco products. Third relates to reducing access to minors. And in fact, it also goes to say that tobacco cannot be sold within radius of 100 yards of educational institution. This is something that goes beyond the recommendations of FCTC. And fourth, that is the display of the pictorial health warnings. So the bullet number 2 is where the genesis of the tobacco-free film movie lies. Because after the enactment of the Tobacco Control Act of India, this is what happened. After effects of tobacco control enactment, what happened was after the enforcement of the Section 5 of the Tobacco Control Act of India, which is also known as COTPA, COTPA, this relates to ban on advertisement, promotion, and sponsorship. The tobacco industry, as we all know, they have a number of strategies, and what they did was they started using innovative methods of circumventing this ban on the advertisement. So when a ban was imposed on all the traditional forms of media, they started using new and emerging forms of media. And this is here they found television and film programs for promoting their product. Film programs, because film is something which is watched across all the class, across all the SES of society in India. And every year more than 1,000 films are produced in India. So this they thought out, it was a very thought out strategy by the tobacco industry. So they started using films. And this evidence was visible and further corroborated by studies conducted before and after the ban was enforced. So we documented this evidence of how the tobacco industry before the act came into force and after they came into force and after. So how the industry was behaving and how they were trying to use this films and television to propagate, to promote their products. So this is a very good example of how evidence was used for policy making. So these are about the research studies that were conducted pre and post enactment of the Tobacco Control Act. So this is about the pre-enactment of Tobacco Control Act. Incidentally, in 2003, the World No Tobacco Day the theme was tobacco free films and tobacco free uh, fashion. And that time there was a study that was supported, undertaken by the WHO on portrayal of tobacco in Indian cinema and its impact on youth audience. So what this study was observed was that 76% of the Indian movies, they portrayed tobacco consumption. Good characters accounted for approximately 50% of the incidents portrayal. The smoking incidence among lead actors rose sharply from 22% in 1991 to 53% in 2002. So this showed a shifting trend, how the smoking scene shifted towards lead actors, because people, they try and imitate the lead actor. So we saw a shifting trend here. And the study also observed that youth behavior was highly influenced by mainstream movies. Then after the enactment and enforcement of the tobacco control legislation, a similar study was repeated by a civil society organization, which was supported by WHO, and the study assessed the tobacco in Indian movies released in 2004 and 5 and their influence on youngsters. So what this study observed was that 89% of all movies, they contain tobacco scenes. 75.5% of the movies containing tobacco depict either male or female lead actor consuming tobacco. So we see that the percentage has increased. 41% of all movies analyzed for 2003-4 shooting of visibility specific tobacco brands and increased visibility. So now there was brand placements was visible in 41% of all the movies analyzed. 37% of all respondents in this study recalled movies with tobacco brands. So now we know that how the industry is playing with the psyche, with the thought process of the youth. And that's why they are placing the brands in the movies. These youngsters could recall either the movie or the brand, or both in at least one movie, providing that tobacco brand placement in movies and its association in film stars have a high impact and recall value. So in a single slide, if you want to understand what was the change from 2003 to 2005 study, so we have tried to depict three key indicators. First indicator is movies depicting tobacco use. So if we see that from the 2003 study, 76% of the movies that depicted tobacco use, from 76%, it increased to 89%. Lead character smoking, it increased from 41% to 75%. So this is a huge increase. And tobacco brand product placement and its visibility. So from 15% to 41%. So this is how the evidence was documented through these two studies, which corroborated what we knew that how the tobacco industry was using films and television programs to promote. And this is how the policy tobacco for film and television policy started to evolve. So we see that in 2005, this is the year where the government imposed a blanket ban on depiction of all scenes and use of other tobacco products in film and television program. So this is a chronology of event which I've tried to show, which suggests that this policy initiative was started in 2005. We had two regulations in 2005. Since it is implemented by the Health Ministry and the Ministry of Information and Broadcasting, that is the servicing agency, because they are the ones who certified the movies. So it's a baby, it's a product of two different departments, the health department as well as the servicing department, which is the information and broadcasting. So when the rules were notified in 2005, the Ministry of Information and Broadcasting came back to the Health Ministry suggesting that these rules are non-implementable. And at the same time, these rules were challenged in the High Court by a leading film producer, Mr. Mahesh Bhatt. He's an activist and a film producer. And thereafter, the discussions were on two fronts, one on policy front between the two ministries and one at the level of the courts, at the High Court and the Apex Court. So we had the first set of regulations in 2005. Then in 2005, 30th November, certain relaxations were further given on old films and television programs. There were also exceptions on historical figures. So any historical figure, if he consumed tobacco, he was allowed, his depiction in movies were allowed, but still these rules could not be implemented. And then there was later on, there was one more amendment that was in 2006. And through this amendment, a disclaimer was inserted. But still, the rules could not be implemented because the High Court stayed these rules because of a court case which was filed by a leading movie personality, Mr. Mahesh Bhatt. And as I said, there was negotiation on two front, one on the policy front between the two ministries, and also at the level of the High Court and the Supreme Court. In the High Court, these 2006 rules were stayed, and the Ministry of Health and Family Welfare, they filed a statutory leave petition in the Apex Court, and the Apex Court had granted stay on the High Court's verdict, and therefore, thereafter, these rules were implemented. At the same time, there was a civil society organization that filed a public interest litigation in Kerala, which is the southern part of India. And this helped the Ministry of Health and Family Welfare to implement these rules. So we see that from 2005, the initial conceptualization of the rule started taking place. There was a lot of negotiation, there was a lot of dialogue between the two ministries, and finally these two ministries, they agreed that there was a need to restrict the display of tobacco products or its use in films and television program. And these rules were implemented from 2012 October and 14th November 2012. So these are the litigations. Most prominent is the first litigation. And there are also other litigation by leading film personalities that have challenged the implementation. But right now, there's clear direction from this Apex Court to implement this very important provision, which when the policy was implemented, there was a joint statement that was issued by both the ministries, that the Ministry of Information Broadcasting as well as the Ministry of Health and Family Welfare, showing their commitment for implementation of these rules. So this is how the rule was framed. So for the purpose of these rules, it was divided into two parts. The rules were divided into two parts. One was for old films and television program, and one was for new films and television program. Old films means which was notified prior to 2nd of October 2012, and new means after that. So we had separate provisions for the old films as well as new films. So for new films, we had four important points. That was a strong editorial justification explaining the necessity of display. There was an anti-tobacco health spot of 30-second duration in the beginning as well as the middle. There was a anti-tobacco audio visual disclaimer of 20 seconds each in the beginning and the middle. And there was an anti-tobacco health warning as a prominent static message during the period of display of the tobacco products. So three elements are very important in this. So what this policy gave to the government was free airtime. Any films or television program, if it displays or depicts smoking or tobacco product, it has to give 100 seconds of free airtime for health education. So this is the big takeaway from this policy. What this policy has done is it has given us the opportunity of public awareness campaign round the clock with zero cost. While there are certain things that these rules restrict, but there are certain things where there's a strict no. So there is also some kind of prohibition. So display of tobacco product cannot be done, no product placement, display of tobacco products or their use in promotional materials. None of the promotional materials or the posters of the film and the television program can depict any actor or protagonist smoking, or there cannot be a display of smoking, display of brand name and logo of tobacco products. So no product placement, no brand placement, no logo placement on the close-ups of tobacco products and tobacco product packages. There was a complete prohibition. The penal provision was very harsh. It said that failure to comply with the rules will entail cancellation or suspension of license by the competent authority after giving reasonable opportunity to explain such failure. So this failure to compliance, the cancellation provision adds teeth to the legal provisions. So just few slides showing prohibition on promos and posters, prohibition on brand placement, prohibition on product placement. And this is how it can be. These are the disclaimer, they are the two spots, and also the static message that is displayed when there is a smoking scene that is being displayed on the screen. So after implementation of this policy, we tried to gather how the policy is being implemented. And in 2015, we undertook a study along with the vital strategies, and we evaluated the tobacco-free film policy. In film theaters, its implementation at 2 points. One is at film theater, and the second one as it was in television programs. So in film theater, we found out that 99% of the films that contain tobacco scenes implemented at least one of the three elements of the film rule. So they implemented either the anti-tobacco health spots, that is of 30-second duration, the audiovisual disclaimer, that is of 20-second duration, or the health warning as a static message. So 99% compliance of at least one of the three elements. But the other feature which we noticed was that only 27% of the films, they implemented all three key elements of the film rules and appropriately. So while 99% implemented one of the three elements, but we found out that only one in four, about one in four movies, they implemented all the key elements correctly and appropriately. And in the television program, It was a bit challenging what we found out. The implementation of the film rule on television was low. Not one program on television implemented all the key elements required by the film rule. Only 4% of the TV programs that we observed implemented at least two of the three elements of the film rule. So here lies the challenge. We have the policy, we know what are the benefits of the policy, but at the level of implementation, while in film theaters, it's reasonably well implemented, but in television program, it shows that a lot of effort needs to be directed towards this front. And the second study which we did was tobacco imagery on on-demand streaming platform, the OTT over the top. So this study was published recently in the Tobacco Control Journal, and the study accessed tobacco imagery in online series popular among adolescents and young adults. We observed 10 series of Netflix and Amazon Prime, 188 episodes, total 188 episodes of 10 series. And we found out that at least about 57% contained at least one incident of tobacco use. And the total number of tobacco incidents in the selected series ranged from 0 to 1652. So the range was, there were series that did not display any tobacco use or the brand display, but there were series which was flagrantly, tobacco use was being depicted flagrantly. The US produced series like The Marvelous Mrs. Maisel by Amazon and Narcos, The Crown by Netflix depicted higher number of tobacco imagery when compared to the Indian produced series like Mirzapur by Amazon or The Sacred Games by Netflix. 4 out of the 10 series studied showed tobacco brands through product placement across episodes, and all of these were foreign productions. So most of the foreign production series, they displayed there was we could see the tobacco brand placement. Two series, The Sacred Games and Mirzapur, produced in India, showed tobacco imagery. However, they did not display the brand name of the product. The study concluded by saying that both the Indian and foreign produced series depicting any tobacco incidents did not comply with the tobacco free film and television rules in India. So this was the study which we documented whether the OTT, the over the top or the streaming platform, are they complying with the tobacco free film policy or not? And we found out that none of these platforms, the streaming platforms, they comply to the tobacco free film policy. Challenges are at multiple fronts. So I've just tried to list a couple of challenges. The first challenge is about implementation. The old movies, how do we implement in own films shown on TV and theaters? So this is one of the challenges that has been highlighted by uh, the Ministry of Information and Broadcasting, which is the servicing ministry for this rules. Then the challenge is about the new and emerging technologies, the OTT platforms, streaming media. So this is one of the challenge which we uh, have experienced. Third is how do we monitor it? How do we keep monitoring each and every channel 24 into 7 and report the violations? So we are still, the ministry is still trying to discuss, deliberate, and trying to find a way out of monitoring, or find a way for monitoring these policies around the clock in all the TV channels. And the legal challenge is always there for any strong tobacco control policy. So this is about first policy. The second policy is regarding ban on smokeless tobacco. This is very important for India because we have 200 million tobacco users. More than 70% of the global tobacco, smokeless tobacco users are in India. And therefore the regulation calls for a whole of a government and whole of society approach. So some of the common types of smokeless tobacco products, these are just indicative list. There are many more products that are available at subnational level. Some of the important products that are available, which I've tried to list, is Khaini, there's chewing tobacco, there is gutka, zarda, there is dipping tobacco, there's also tobacco water, there is snuff. So some of the key types of smokeless tobacco products, but there are other products which we cannot be named, which can be named, but which is assembled at the point of sale. It is in the unorganized sector and beyond most of the regulations. There cannot be any pack warning. I've tried to show the chronology of events, how the different acts have been used from time to time to regulate the smokeless tobacco products. Various regulations have been used from time to time. In 1992, there was a ban on sale of toothpaste and tooth powders containing tobacco under the Drugs and Cosmetics Act. During the period 1996 to 2003, several state governments, India is, as you know, India is a federal structure. So we have national government, we have subnational or the state government. Several state government at that point of time, they had started uh, implementing the rules on prohibition of smoking in public place. At the same time, they also had spitting laws in their jurisdiction. So spitting, that is during that period, spitting laws were enacted in a couple of states. And coming to the period 2001 to 2003, this is where the state governments, they started acting very strongly on the smokeless tobacco, and there were state governments at subnational level which in fact prohibited the manufacture, sale, distribution of the smokeless tobacco product under their Prevention of Food Adulteration Act. So we have the Drugs and Cosmetics Act, from where the toothpaste containing tobacco was banned. Then we have the Prevention of Food Adulteration Act, where smokeless tobacco was considered as a food item and they were banned. At the same time, in 2003, we had the Tobacco Control Act. And through the Tobacco Control Act, we did not ban, we regulated the sale, we regulated the advertisement. The act recommended pack warnings. It cannot be sold around education institutions. It cannot be sold to and by minors. So these regulations were progressive in nature, but it did not recommend a complete prohibition on the sale. In 2004, what happened was the Supreme Court quashed the ban that was imposed by the state government, saying that the state governments do not have the power to ban the smokeless tobacco products. So these are some of the events in 2005. Again, one of the state government, since in India, uh, health policy or health, it falls into the domain of the state governments to formulate policies. So state governments, that subnational jurisdictions, they have the power, they have been vested with the power to formulate policies impacting public health. What happened in 2007 is very important. This is where the entire action started shifting. In one of the states in the western part of the country, that is Rajasthan, the High Court banned sale of gutka, pan masala in plastic sachets for being a major toxic pollutant. What happened was that there was a civil society organization called the Indian Asthma Care Society, which filed a public interest litigation in the High Court, saying that the pouches, gutka pouches of the smokeless tobacco products, they are uh, choking the sewerage of the city. And it is here where the court take a very strong decision view of this, and it fined the tobacco manufacturers and other forms of chewing tobacco product manufacturers on the basis of polluter pays principle. And the tobacco industry, what it did was it challenged this ban in the Supreme Court of India. So while the Supreme Court of India was hearing this litigation, one of the judges remarked, if smokeless tobacco product pouches are so harmful to the environment, how harmful is it to the health of the individuals during this court case? And as per the recommendation, the National Institute of Health and Family Welfare, one of the public health institutes of the government, it directed that they should prepare a comprehensive report on the contents and health effects of this smokeless tobacco and the areca nut, which concluded that SLT areca nut causes cancer and other disease. So it is here that action at national level started in a more stronger manner. And at that time, expert committee was constituted by the Ministry of Health and Family Welfare, which submitted a voluminous report. So this committee, it documented the existing evidence, and a report of 1700 pages was filed in the Supreme Court of India as evidence of what is the impact that smokeless tobacco causes to the health of the individuals. And at the same time, what happened was that the government of India released the Global Adult Tobacco Survey, the first global adult tobacco survey, and we found out that there are 274 million tobacco users in India, and 206 million were users of smokeless tobacco. So at multiple policy fronts, different actions were taken, and this culminated into taking strong actions against smokeless tobacco. 2011, there was a national consultation that was organized by the Ministry of Health, WHO, and the Public Health Foundation of India. And in this consultation, one of the recommendation was to im- impose a progressive ban on the production. And thereafter, in 2011, what uh, the Food Safety Authority of India, they notified the food safety regulations, which as per the regulation said that tobacco or nicotine cannot be added to any food products, and thus this led to a ban in certain forms of smokeless tobacco, packaged smokeless tobacco products which were flavored. So 2012 was the year when the first state, that is state of Madhya Pradesh, was the first state to ban the sale of gutka and pan masala containing tobacco and nicotine in compliance to the regulation 234 of the food safety regulations. And thereafter, the court took a strong opinion and it started directing all the states that they should take action against the tobacco manufacturers in compliance to the 234. And by 2013, 2014, almost all the states and the union territories, they prohibited the sale of gutka and pan masala with tobacco and nicotine in the country. So now the war becomes more interesting. It's interesting to know what happened after that. So this is what the industry did. They came up with a print media campaign across the country. So these are some of the messages they were trying to confuse the policymakers. 14 states in India believe cigarettes are healthy. Is it fair? The second public notice was, we are aggrieved due to discrimination, seek fairness within the framework of law, appeal for equal treatment. This third message, 4 crore people lose livelihood. So typical industry playbook strategy, loss of livelihood because 14 states in India believe that cigarettes are healthy. So now they are trying to confuse the policymakers, suggesting that this policy of yours is trying to uh, make the people of India believe that cigarettes are healthier. And the last message is gutka a food product? 14 states believe that gutka is a food product. Gutka is clearly a victim of policy manipulation. So now they want to come, so they're trying to convince this government, saying that gutka, the smokeless tobacco, is already under the Tobacco Control Act, which does not prohibit its manufacture. It only regulates. So they're now trying to convey the policymakers that, look, we are ready to be regulated. So this was the strong print media campaign by the smokeless tobacco industry, typical industry playbook strategy. And now what the ministry did. So the ministry came up with a similar public notice published across the country. So this is what the ministry said in its campaign. Later on, the ministry also launched a mass media campaign. So this is one of the good examples where a policy is supported by a public awareness campaign through mass media as well as outdoor media. So this showed the commitment of the government to protect its policies. And at the same time, after the ban was enforced, WHO, along with the Johns Hopkins University, we tried to understand how the ban was being implemented in certain states, and we had found out that the tobacco industry, so to circumvent the ban, the manufacturers were selling gutka in twin packs, that is pan masala and chewing tobacco in separate packs. but conjoined and sold together. So this is how the industry. So we know that the industry is like a hydra. It can change its shape, its size, and they always have some ace under their sleeves. So from one product, they now become two product. Gutka became pan masala plus tobacco. These are separate products, but they were sold together. And Supreme Court noticed this and it directed the state governments to ensure that tobacco product and pan masala and the tobacco was not sold together. So from 2012 to 2019, what the state governments did was that they applied this law to prohibit other types of smokeless tobacco products, the flavored chewing tobacco products. Some of the states also went beyond and banned all forms of chewing scented tobacco products, areca nut, as well as pan masala. This was done on the interest of the public health. And under the food safety regulation, the state governments have been empowered. The subnational governments have been empowered to take action under this section 32 of the food safety regulations, and this action can be undertaken in the interest of public health. So the challenges are multifold. A lot of challenges are there. Since I've tried to enlist just 5 key challenges. Number one, there is plethora of smokeless tobacco products that are produced and consumed in the country, and many are in the informal sector, which are assembled at point of sale, and they are beyond any regulation. They are devoid of any regulation. The twin pack by the industry, which circumvents the ban, that instead of gutka, now they are selling tobacco and pan masala, but they are two different products sold together. One comes free with the other. The tobacco comes free with the pan masala. The third challenge is the packs are very small, they're packaged attractively and sold at very low price. All these combined, the effect of these combined is that it gives easy access to the youth. The ban is non-uniform. Every state has a different kind of ban on a different kind of smokeless tobacco product, and the ban as per the act is limited for 1 year, and every year there has to be a new notification. So every year the state has to notify the ban. And last but most important is the brand sharing and the brand stretching exercise which the pan masala brands do. So we see one is Pierce Brosnan's famous James Bond's, and other one is Ajay Devgan from the Bollywood. So these are the kind of brand endorsements they get, which leads to surrogate advertisement, the brand sharing or the brand stretching. This is the last policy which I'll be focusing on. This is very important because the tobacco industry is also focusing on them. Catch them young is their code word. And tobacco industry is found where the youth is. They will be found across the school, they will be found in the school, they will be found on the new and emerging platforms, on the streaming platforms. So this is a very important intervention. If we want the prevalence to reduce, then our focus should be on reducing access to minors. So how does the Tobacco Control Act of India reduce access to minors? So under section 6 of the act, no person shall sell or offer to sell or permit sale of cigarette or any other tobacco products to a person who is under the age of 18 years and in area within a radius of 100 yards of educational institution. So 100 yards of education institution is approximately 93 meters from the education institution. And this goes beyond the recommendation of the WHO FCTC also. So this is what the rule says. At all point of sale, we should have one of these two boards saying that sale of tobacco product to a person below the age of 18 years is a punishable offense, and no product should be sold through vending machine. No product is handled or sold by a minor. No product. The onus of proof that a buyer of tobacco product is not below the age of 18 years lies with the seller. So the power on identifying the age of the buyer lies with the buyer, and the buyer, if he feels circumspect that the uh, user is below the age of 18 years, he can always ask for an ID, and the penalty for non-compliance of this provision is up to 200 rupees. This is slightly on the lower side, but still this is a very impactful policy. So all the schools, they have to display a mandatory board at the entrance, and this board, the text of the board is given in the rules. Sale of cigarette or any tobacco product within a radius of 100 yards of education institution is a punishable offense with fine up to 200. And this 100 yards is measured from the radially measured from the outer boundary wall of the educational institution and not the building. It is the exterior boundary wall of the educational institution. And in order to implement reduce the access of tobacco products to minors, the government of India has recently come out with a tobacco free educational institution guidelines, and the objective of these guidelines is to provide fresh momentum to implementation of tobacco control initiatives among the adolescents and the young adults. So the focus is adolescents and young adults, and educational institution means all the schools as well as colleges. So it's not only school as well as colleges, because in India, we know India is a young country, and about 50% of the population, it's below the age of 30 years. So if we say 50%, which means uh, around half half billion, more than half billion, 0.6 billion. We have 1.3 billion population, so around 6.6 billion is below the age of 30 years. So it's a huge population, and it's important that tobacco control intervention reaches this population. And unless we reach this population, the prevalence will not come. The national health policy goals or the sustainable development goals cannot be reached unless we reach this young and the adult young adult and the adolescents through our intervention. So these guidelines are primarily meant to reach those adolescents and young adults. These guidelines are to be implemented by all educational institutions, whether it's in the public sector or it's in the private sector. They have to implement it. And this is a kind of targeted intervention. So it's a targeted intervention among the youth for behavior change. It's also a targeted intervention among the teachers, because they are the role models of the youth. And this policy will be implemented among the youth through the teachers. And it's a huge opportunity. This policy provides a huge opportunity for the government, for the policymakers to engage with the youth for tobacco control and make them their future advocates. And what this policy is gives is that there is a self-evaluation scorecard for tobacco-free education institution. So based upon these cards, the education institution can rank themselves. So there are 11 points and total marks is 100. One of the other important elements of this tobacco-free education institution policy is that it says that education institutions should not partner with tobacco industry or the industry backed funds for conducting or undertaking any activity in the school or outside the school. So this is very important, because tobacco industry of late has been partnering through their fronts as a part of the CSR, undertaking various activities. One of them is the global activity called the Conrad Challenge. So this is a self-evaluation score sheet under this policy. And these are some of the mandatory boards which the policy mandates that education institution. So in addition to the name of the person to reporting violation, these boards also display the quit line number. So we have a quit line in India. So it's a kind of a advertisement of the quit line also, as well as the same time you can report the violation. This policy, what also it does is it says that each class should have one monitor. It's called designation of tobacco monitors. So every class should have a tobacco monitor, and the name of the tobacco monitor should be displayed in the school. So The challenge is that there are the number of schools, if you want to know, this is the figure from the government of India. This is figure about the number of schools. Schools, when I say schools, it means up till class 12. So we have 1.5 million schools till class 12. The number of teacher is 9.4 million teacher, and the number of school students is 247 million. So this is the challenge, is to reach these people. And there lies the opportunity, that we have the opportunity to convert so many people, to prevent so many people from getting addicted to tobacco, nicotine, or any other emerging forms of addiction. So wherever there is a challenge, lies the opportunity. So thank you so much.
Super. Thank you so much, Praveen. That was fantastic. Great history showing sort of the progression of the fights for these strong policies and the opportunities, and also some of the challenges. And I think one of the sort of challenges that you lay out with I guess all three of the examples is the implementation of these initiatives that with the movies and smokeless tobacco, they're from some very strong policies, but then you laid out, they're not necessarily, we're not getting full compliance with those policies. And then we've also have challenges with preventing youth access to tobacco. So do you have, what is the path forward? How do we work on that sort of implementation side of things? Do you have any advice for us?
So there is no straight jacket solution for it. It has to be tailor-made. It needs to be implemented from national level to sub-national level, lot of capacity building, regular monitoring. So these are some of the things which I can recommend: use of IT for sharing of information, use new and emerging technologies for monitoring, reporting violation, taking action. So these are some of the things which we are ourselves learning from doing it. So it is challenging. It's a large country, 1.3 billion population, smokeless tobacco. Most of the forms are unregulated, unorganized. How do we regulate them? Massive challenge, massive challenge. I don't have any ready-made solutions for it. Every year we are learning new things of doing it. For tobacco-free generation, many state governments, they are going for vendor licensing. That is one of the new things which are still we are learning from doing, and some of the states, they have done it.
Great, thank you. And one approach might be to focus on either the states or the cities or the areas that have been doing well, and learning from those successes as well. There are many people have indicated in the chat that they really enjoyed the presentation, so thank you. We just have like a minute or so, and I have a somewhat huge question from one of our attendees. I'm going to ask you, unfortunately, we don't have a lot of time to answer it, but maybe we can continue afterwards. But let me just put out this question, because I know this individual is really searching for answers. So he says that despite India being a signatory to the Framework Convention, the government is subsidizing tobacco crop cultivation. Insurance companies invest in tobacco shares. MPs and legislators openly promise better returns to tobacco farmers. Politicians with tobacco conflicts of interest are appointed on the Indian Parliament panels on tobacco control. And the government of Karnataka has licensed a tobacco company to start a nicotine extraction plant in Mysuru, knowing fully that nicotine liquid and crystals can be misused by young smokers for vaping and hookah use. So I guess I think the question is sort of, despite the the commitment to the Framework Convention, why again are we still having these kinds of issues and struggling with them and not full compliance with Article 5.3 and some of the other aspects of the Framework Convention?
Very difficult question to answer, but I'll answer it from a different perspective. 2003, before 2003, we had an Act of 1975. How we have progressed. So since we are the second leading producer of tobacco products, our progress, if you see, has been quite a meteoric. 2003, we had the Tobacco Control Act. 2004, the act was enforced. 2008, we had the revised smoke-free rules. 2009, we had the pack warnings on only front panel. And within a couple of years, we had the pack warning 85% both the sides with a quit line number. 2007, we had the pilot phase of the National Tobacco Control Program. 2012, the government implemented full National Tobacco Control Program. There was funds at national level, there's funds for sub-national level. By 2013, 2014, all the provisions of the act, they were enforced, massive training programs. 2011, we had the Global Adult Tobacco Survey, we had the data. So if you see the progress, our progress has been gradual, our progress has been sustainable. If you look at from the perspective of different ministries, Ministry of Commerce, now if you look at the annual report, they say that every year we will reduce the tobacco crop size by 5%. Now we have the Ministry of Labor, they are doing alternative livelihood for BD worker. So our progress, while the challenge remains, but our progress has been gradual, our progress has been sustainable. Recently, we have the Code of Conduct, 5.3 Code of Conduct. So it's right now it's limited to the Health Ministry, but it's a step moving forward. We never banned smokeless tobacco. 2011, the ban started coming national level, huge impetus at sub-national level. There are a lot of people. So 2011 or before that, there were only a handful of people working on tobacco control. 2020, you see. So it's a gradual progress, and I believe this. The more we start engaging, so in tobacco control, I'll go back to my first answer. So what is the key to tobacco control? Engagement with the community. So right now, the people who do not use tobacco is much larger than the proportion of people who do not use tobacco is larger than people who use. So community engagement, for any policy to be successful, the key lies engagement with the community. So that is where we have to keep engagement with the community, the focus on smokers, but also as potential smokers, the youth. As I said, that is the youth engagement will be our ace under the sleeve. That is our ace for tobacco control in India. So this is how I could, I don't have any, there cannot be any strict formula for this. So gradually working, progressively working, keeping the focus, sustained focus. So that is how we are going to achieve it.
Well, that's a great point to end on. I'm really sorry. We are out of time, unfortunately, but we'll continue the discussion. So thank you so much, Praveen.
These are all peripheral issues.
Appreciate it. Thank you.